I,
Hello, Dr. Uju.
I'm fine. Hi.
Hello.
Fine. Did you get should I just send okay, maybe we
I
can
got it.
present from here.
I got
You
it. No
got
worries. She just sent it to me on WhatsApp.
okay.
Yeah, perfect.
So and I'm wondering if it's possible to go first because I need to sign off to I'm actually it's early in the morning, but where I am, but um
Okay.
if we could do first is I don't know what the schedule looks like, so I can sign off while she continues in the meeting.
If Kay and Anthony and William and gentlemen enough, you can say thumbs up on
Of
screen.
course.
Good.
So then Uju's
Okay.
partner can have some morning peace instead of listening to her on the online.
Perfect. Okay, so let's, I think we can start. Again, hello everyone. So nice to see your faces, even though it's online. We've seen some of your faces in April in Amman in Jordan. So it's nice to see you here today. And today we will be discussing the integration of livelihoods into rehabilitation. We will be framing the rationale of this discussion in a bit. But before that, I want to, as always, remind you of the house rules that I'm sure most of you are familiar with by now, and then give the floor to Lisa. So, as always, remember that there's simultaneous interpretation from English to French and Spanish. So make sure you're on the right channel under the interpretation icon. And I'm gonna kindly mute Lenin here. There you go. And today we have a good crowd of panelists from Nigeria to Albania, Kenya, Sri Lanka, who I will be introducing later. And they will be sharing their experiences with this integrated approach, integrating socioeconomic support into their existing rehabilitation programs. And we hope we will have an insightful session with hearing from different experiences from different parts of the world, as always. So we encourage you all in this call to share if you have worked with this integrated approach or if you have any experience that relates to the experiences that you'll hear from today. Yeah. But with that said, and before we delve into the discussion, I'd like to give the floor to Lisa Henry, IRCT Secretary General, to warm up the stage. If you can say that.
Thanks a lot. Thanks a lot. Yeah, warming up the virtual stage. That's quite a task about that. But great to see you all. I said, my name is Lisa, and I'm leading the secretariat here. We're based out of Copenhagen, Denmark, and we're primarily here to facilitate the work done by the members of IRCT. So we have a massive world map on our wall showing the 172 members around the globe from 76 countries. So many of you are here today and you know this space. It's primarily 10 months of the year. We have a webinar. It's a theme that's decided by you. And it's a theme that has where there's a need to actually have a response and have a discussion and to learn about best practice. And then to actually hopefully take things from this webinar home with you into your organization, introduce them and see if we can have better implementation around some of the things you learn here. Not only that, but it's a space, as you can see, a safe space. It's a space where we know each other as professionals, and we continue to look forward to having these meetings in a world where it's really tough and you can sometimes feel quite alone with the work you do. But just to position this discussion, we work in the IRCT, obviously with the right to rehabilitation. We all know that victims of torture have an explicit right to rehabilitation under the UNCAT, right? The Convention Against Torture and Other Cruel, Inhuman, and Degrading Treatment or Punishment. And we know that rehabilitation, right, the aim of that is to restore as far as possible torture victims' independence, physical, mental, social, and vocational ability, as well as their full inclusion and participation in society, right? States have a duty to provide this rehabilitation. And in the absence of states doing this, it often falls upon the NGO community the non-governmental community, to fill the gap. So this is the piece we're talking about today, the piece that has to do with social and vocational ability that allows survivors to feel included, to feel seen, to feel heard, and to feel healed. So what do we know as facts? Because members across our membership have responded into global impact data, we know that the centers of IRCT are treating over 81,000 survivors, which is quite an amazing figure, knowing that funding has decreased over the years. We know that over 55% of survivors are women, and that 58% of survivors live under the poverty line. So what does that tell us, right? It tells us there's a correspondence between the work we do with some of the great things that the United Nations and international decision makers around the world have decided, that there should be something called eradication of poverty. This is the sustainable goal number 1. So the work we do on rehabilitating torture survivors and providing them with socioeconomic ability to take care of their families can potentially move them out of poverty. 1. 2, we know there are a lot of people who can be left behind. So the work we do in IRCT, I think, very much focuses on especially invisible for many group of survivors that should be included. They should be seen and they should not be left behind. The last thing that we do, which puts us in a position of interacting with the international humanitarian and human rights community, we correspond and work very much into the statement, nothing about us without us. So torture survivors, and I think most eloquently put by one of the social workers in ACTV Uganda, said, rehabilitation for torture survivors without livelihood support is like trying to drive a car without wheels on that car. So this is us saying and involving survivors in decision-making, and survivors saying quite clearly they need this kind of support. So we're here today to try and explore that more. We know that there have been 21 grants given out from IRCT in the past 3 years, and this was in the strategic period when we focused on this theme. We know these grants have gone to members in 11 countries. 4 of them will be speaking today. We know support integrating mental health or the psychosocial support. It's usually 10 sessions where a survivor comes to a center, recognizes they can go to an IRCT center, receive psychosocial support in a safe space, but also receive simultaneously rehabilitation support. And what does that do for them? How does that improve their well-being? So we're not just looking at the mental health, but also the socioeconomic ability for survivors. So if you learn to sew and you're able to sew clothing and sell it, if you learn to take care of a plumbing system in Lebanon, you're able to have an income there. You're able to gain status in your family. You're able to potentially pay for school fees for your kid, and it helps you get back on the path to healing. And that's what this organization is all about. So I welcome you to join the discussion today. I welcome you to talk and ask questions of your 4 colleagues from Kenya, from Sri Lanka, from Albania, and Nigeria. Their experiences are different. We know survivors are different. But this is the space in which we hope very much you will learn, challenge each other, and then hopefully take some of this home with you. Thanks very much. Back to you, Bauta.
Thank you, Lisa. Thank you very much. And yeah, I think I will go directly to introduce the 4 brave panelists who have kindly prioritized their time to present today. And these are, and I will say by order of presentations. These are Dr. Uju, Agomoh, and Azuma Agnes from Prawa, Nigeria. Kay Brisku from ARCT Albania, William Omondi from IMLU Kenya, and Anthony Jesuthasan from FRC Sri Lanka. I hope I said it correctly. So the way we will do this is that each of the presenters will get 8 to 10 minutes to present their projects. What type of socioeconomic support was provided, the impact, etc., etc. And this will be followed by some questions, and then we will open the discussion. So Please listen in and make sure you keep your questions for the Q&A spaces. I will make sure that we don't leave them all for the end, so that there's some, maybe we do 2 rounds of Q&A to have a more dynamic session. But yeah, with that, I think we're ready. If Dr. Uju and Agnes are ready,
Okay.
I can share.
Yeah.
Let me know if you want me to share the
Yeah,
screen.
you can share, but I can also share from this end. But if it's better for me to share from your own, whichever, you can do so.
I
I
have it
would,
ready.
yeah,
I
I
can
would
do it.
present, yeah, and then we'll take questions. Both myself and Agnes will take questions and all of that.
Perfect.
You will also notice, for those who are on the WhatsApp platform, I have posted some pictures there, and I did that purposely because I will speak to that briefly. It just to say to all of us that it is a sea of difference. You know what you see in the faces of the survivors before intervention and after intervention. So again, I want to thank IRCT for providing support to Prawa to engage in the survivors' livelihood support intervention in Nigeria. So let's quickly move on to the next slide. We'll do a little bit of the overview and the objective and goal, the challenges, and then we will look at what interventions were given, the impact of those interventions, and what are the broader strategy for sustainability, as well as the lessons that we've learned through this intervention and what recommendations we think should come next. Yes, next. Um, Basically, as you know, this is specifically reporting on the intervention that came following the support Prawa received from IRCT. Let's move on and to the next slide. Above is actually the goal that we looked at in terms of what key um, interventions that are required, but you see the objectives that we set out for ourselves. We wanted a situation where there would be a comprehensive intervention, and here, to some extent, we want to make sure that it's about livelihood, is about medical, psychosocial, is also about medical intervention. And it's important to note that before this intervention, most of the challenges intervention has been either just the psychosocial, so it's not being able to have opportunity to meet the different aspects that we feel that the interventions are required to be given, and also to look at ways of establishing small scale interventions that can be sustainable, which includes both agriculture and non-agro interventions, and also to ensure that there is opportunity for peer exchanges, opportunity to track progress, and then of course the opportunity to do an assessment before, but also continually assess the impact of the intervention. And again, through this program, it was also about building the capacity of Prawa and our partners in terms of delivering this comprehensive intervention in this form. Let's move on to the next slide now. There were challenges we saw before those interventions, and part of those challenges is the fact that many a time the centers, we do not have the required resources in financial to be able to support the survivors, as it were, both in terms of sustaining themselves economically, and many a times it is also because there are no skills or because there are no financial capital to do so. A lot of hardship, the financial hardship, was also observed in terms of the targeted group, and unfortunately there's not enough social structure to help maintain or deal with those gaps, unlike in many developed countries. So here you would really need to see the importance of dealing with this particular issue, more so given that we are dealing with serious vulnerability and trauma that we have observed for the target group. Yes. Okay. So what were then was this intervention? And please let me also say that again, I should have actually have done this in the first instance. I want to thank Agnes because for putting up this a PowerPoint presentation. So so all of the things you're seeing on the slides were actually things that she herself put in place. She developed this. So it's important that I acknowledge that. So what again did we do in terms of this intervention? So the first, there was issues around the nature of the intervention. It was financial. It was also, which of course helped to support the business startups. It was also providing tools and farming abilities. It was also about customizing the intervention to meet the peculiar interests of the survivor. It was also about the visibility to the business that these survivors have taken. But remember that before we started doing this, there was a proper assessment, both physical assessment, economic assessment, and all of that. I will speak to this a little bit in a while, but it's important to notice this broad spectrum. Yes, please, next slide. Okay. Now, remember I said to you that when we started the program, first thing we did was we had a base assessment to see the context that the survivors were going to be faced with, even at home. We have started some discussion, online discussion, hearing stories of many of those survivors and also their needs. So we convened a meeting, a first workshop. It was a residential one. Excuse me. It provided us opportunity to assess medical status and health, so of course, the health status of these survivors, but also when it came to, of course, also the legal. So we had lawyers coming to do that. We took them to a hospital, and there were general tests, medical assessment tests, and all of that. Counseling was also part of it. Then there was also the business aspect of it, the financial aspect, where we asked them what were the things they were already doing to generate income, if at all. If they didn't have any, what was the skills that they currently have, and areas of interest. And this was really important because we wanted that whatever support that was going to be given to them was be support that aligns with their interests. And we wanted also to look at the issues around sustainability in terms of those support. And that was why we made sure that the issue of the medical was something that we addressed first before giving the psychological, the comprehensive financial support in one form and or the other. It's also important to mention that there were also instances when, if the cost that they have projected in terms of the support they needed was much, we tried to bring it down to something that is very realistic, because it wasn't like we did it was just that we wanted to make sure that the funds available was going to be enough to deal with the number of persons that we had. What was the impact we saw? From the intervention, we started seeing some form of financial independence and self-reliance, even in the posture, beyond just the money in the finances. There were examples. For example, one of them told us of the fact that now the children usually were so happy because they said anytime they have needs, that is the children, they would be in a situation, oh, wait, let us go and beg this your father's, because the husband of this particular one currently is also not, is also incarcerated at the moment, still on the same political context. But then, instead of saying we're going to wait for your uncle to give us money for your school fees, the children will tell her, okay, now we are happy because you will say, let us produce some of the things that we have taught her, because her skills, she's producing soap, she's producing cream out of this. So that is financial independence and self-reliance, including even how in the confidence that it builds in them, was also something we noticed. We also were able to observe active business engagement, and some of them began to produce very tangible things that we could see. And this was actually very, very helpful to see. Again, we started seeing many of them beginning to build more in terms of their community ties, and more recognition in the community and the rest of it. In short, in one of the instances, the lady said the schools around where the children were going to school were now inviting her to come and teach students her to produce some of the things that she was also doing. So her impact in the community also began to increase. Let's move on quickly to the next slide, please. Okay, there are key things that we think that are necessary if this is really going to be sustained over a longer period of time. So the first thing is that it's important to build capacities. These capacities, of course, capacities of the key stakeholders that we're dealing with. So in this instance, we had doctors, we had nurses, we had a particular hospital that we had partnered with. As a matter of fact, two major hospitals, that we got involved in. Whether we found that the issue about sensitivity. Sorry, the sensitivity around this issue is something that we need to make sure that all of the partners are also aware of it. The issue around advocacy is something also important. We also need to look at how do we build more in terms of collaboration, in terms of community engagement, in terms of deepening more of the vocational skill training. But again, how to ensure that financing becomes something that is sustainable. So imagine if there is no grant coming, is there a way maybe with microfinance system to see how they can key into this? I mean, I know it may be a long thing coming, but the question is that it in any form that these funds can be made to be a sustainable strategy, it will make a whole lot of difference. And of course, the issue of ensuring that the scalability around this issue, but through monitoring and evaluation, and it's also scaling up of the intervention. Please, next slide. There were some lessons that we learned, and one is the key thing I felt that is important to stress those lessons. One of those is that, you see, when we have holistic support, we get better outcomes. As I said before, we could only maybe take one aspect, psychosocial, or you take legal, or you take just medical intervention. But a holistic intervention, and of course, that recognizes the place of livelihood is so key. So again, holistic intervention is a way to go. Number two, community engagement is very, very important. How to engage different partners in the community, build survivors network to also help to encourage peer exchanges, and even if it's just in terms of increasing their self-confidence through that point, and also ability for them to have a wider network for self-help, and again to increase sustainability would be something very helpful. Then again, the third lesson here is about the importance of tailor-made interventions. Tailor-made intervention is works best. You need to ask people, what do you like to do? Why have you had experience doing this? Why do you like it? Do you have the skills? Do we need to build your skills? Things like that. So people, whilst livelihood support is important, we must ensure that that livelihood aligns with the interests of the survivors, aligns with the capacity of the survivors, aligns with something that can easily be rewarding in terms of economically generating income within the context where they are. Because if they pick something, a business or skill or something that completely does not give the financial reward, it will also discourage them. Next slide, please. The other one is about the fact that psychosocial challenges often affect livelihood outcomes. So we need to be sure that as we're dealing with this, we don't ignore the psychosocial challenges. The same can be also said in relation to medical challenges. So it is also important that we're able to have an eye there. So livelihood will strive better when some of these challenges are actually being addressed as well. I've talked about the fact that community engagement is essential, and that we must look at ways of sustaining. So sustainability is a key thing. So it's not just about starting things, but how do we ensure that this is sustained over time? Are they governments? Are they private sector? Are they other players in the field that can come in and pull into their support level? That is also important. And in terms of the community engagement thing, the issue around ensuring that trauma-informed care and things around economic inclusion strategies are also being put together to help to support survivors in the longer term, and that partners are also supposed to be encouraged to know more about this system. Please, let's move on to the next slide. What are the recommendations? There's need to scale up, and scaling up with looking at local government collaborations. Can that happen? And how do we get other players in the field? Again, there's also a need to encourage peer support, and survivor-led advocacy. In Prawa, we've already started this, but this needs to also continually to be strengthened, where we promote community healing, peer mentorship, and things like self-sustaining psychosocial support. There's also a need to develop comprehensive tools to ensure that the different players in the field and as stakeholders are clearly able to track progress, both in terms of the livelihood support, in terms of the medical support, and in terms of the psychosocial well-being and legal outcomes that are actually that are put into being in terms of the project, just to ensure that both issues about accountability as well as learning, expanding our knowledge base in this is something that we need to encourage. Please, next slide. Next slide, please.
I think this is the next one. It's number 4.
Okay, yeah. So again, the point about the institutionalizing trauma-informed care. This is really important so that it's seen to be a continuous thing. The issue about tailor-made vocational trainings was also important. The issues about ensuring capacity building for key stakeholders. I think it's, again, from those lessons that we've learned that we're looking at the importance of these being recommendations that can be instilled into this program programmatically going forward. Next slide, please. Okay, so again, using the findings of what we have to promote both state and national policies to be able to target provision of support to survivors is also important. And again, to see where we can seek co-funding, co-support from other players, just to ensure that similar things support are actually being put in place. Okay, me see the next. So I think the basic thing I had mentioned here, it's the fact that holistic. I think that's just the main trick. The fact about the holistic intervention and how this can be weaved together into a program that will actually, because it's doing quite a lot. Not only that it's increasing their well-being, it is building on their confidence level, improving on their confidence level. It's ensuring that they are also beneficial to the community. It's affecting their extended families, in this case, some of their children. It's also providing quite a lot beyond just what ordinarily you would have targeted in terms of the program. Please, let's see whether we can see some of the pictures, because I believe that those pictures, yes. So so you can see some of the pictures. So there was a pre-assessment visit, as I said. Agnes and the team in the Prawa went before to some of the families to know how those families are and how the people are. Then after the visit, then we had the initial workshop where we did a lot of the assessment, psychological assessment, and all of that. And up the picture up there with the group picture, we actually invited the commissioner in charge of women affairs, to just begin to let the government also know that this is an area they should look at. And then there's the various support that we're given, and there's a banner for visibility, indicating also their phone numbers and all of that. Okay, so can we quickly
And Dr.
look at
Ujo, I
yeah.
think we'll have to leave it here because we
So
went a bit beyond time.
okay, so I think that's it. The pictures are there, but please do find time to look at the ones on the WhatsApp, because those ones tell you how they were. I mean, I love those pictures. That's after intervention. Thank you very much.
Perfect. Thank you so much, Dr. Ujo and Prawa team and Agnes for putting together the slides, of course. And yeah, you touched upon a couple of things that we were actually intending to discuss at the end of the discussion, such as this community engagement being essential, the sustainability component, etc., etc. But we'll leave this to the end. I'll now kindly ask Kay from ARCT Albania if he wants to share his screen and share the presentation. The floor is yours, Kay.
Yeah, thank you very much, Bertha. And hello, everyone. I am Kay. Just a moment, please. Yeah, from the ARCT Albania. Actually, we have implemented a very nice and impactful project in terms of livelihood support. And when it comes to an end, we could recognize that the livelihood support is such a rehabilitation tool and is one of the most powerful rehabilitation tools. I want to start with a brief description of the organization. So ARCT is one of the first organizations in Albania, representing a non-profit and non-political organization since 1994. We used to offer direct services to the torture survivors in Albania for more than 30 years. And now, for the first time, we used to embed livelihood support into our strategic plan and implementation of the project. So for over more than 3 decades, we used to offer psychological, medical, and legal needs for the individuals who have endured some of the most severe forms of violence. But what we used to recognize is that many survivors, especially in Albania, have quietly expressed that healing cannot happen into isolation. So we implemented the project in terms of offering digital pathways to recovery, enhancing livelihood support for torture survivors in Albania. That was a pilot project, mostly focused in Tirana and Shkodra districts, where are the 2 main districts with the most torture survivors documented in Albania. And regarding the project, actually, we focused on the survivors of torture, former political prisoners, and according to the National Institute for Statistics and International Statistical Institute, the torture survivors in Albania used to face a lot of chronic marginalization, lack of skills, and socioeconomic exclusion. So we had over 75% living in poverty, and this is the highest national employment rates among vulnerable groups in Albania. We used, after the project, we used to incorporate the livelihood support even in the organization strategic plan that I will gain the leadership of the organization for these 3 years. That will be one of the main focus, empowering the survivors and not only treating the survivors in terms of client and beneficiary clinical approach. So we used to start the project in terms of kickoff meetings. So we used to engage with the national stakeholders and the National Employment Agency through a memorandum of understanding as a long-term impact of the project in the country. So in terms of building bridges between civil society organization and the state institution to empower not only the civil society, but the survivors themselves. So they could have a voice in terms of employment, trainings, and being part of the state national agency for the employment. So to offer, like it happens for all the vulnerable group in the country. Now this is a fact after the implementation of the project, even for the torture and trauma survivors. Mostly our project focused in realizing workshops for the digital literacy trainings. So we used to conduct a study in terms of dividing and introducing the survivors from Albania with the technology. According to the last data in the Western Balkans, the most demanded jobs for the moment are in the tech industry. So I find it very relevant and very useful for the survivors to introduce them with technology. So starting with a group of 3 workshops in terms of introduction to basic digital tools such as internet use, cybersecurity protection, email, and productivity apps such as Canva or social media platforms that may be a tool for them to get into the job market. Then we used to incorporate 3 other trainings after selections between other ages of survivors. So we can add here even the newly identified victims of torture. As in our last reports, we do have police brutality in Albania, and a lot of newly identified victims of torture do not have any support in terms of reparation or livelihood support. These trainings were based into more advanced skills, which can introduce our survivors not only in the Albanian job market, but even into the remote job opportunities. Through these actions, we aimed to empower them. Through the empowerment, the survivors within the employment, they can restore hope where trauma was silenced it. So they are, after the training or after the intervention, according to the evaluation that we have done, we have seen that the survivors are feeling more comfortable and more empowered. We completed the project with a baseline study. So was about the findings, was about the long-term impact, and promoting best practices, not only for the torture victims, but including trauma survivors, veterans, etc., that may serve as a tool for the rehabilitation for future livelihood programs. I want to add that livelihood support can be as a trauma-informed practice. Accordingly, designing the project with sensitivity to trauma, we used to create and empowering spaces for the survivors so they can rebuild trust, develop agency, and experience competence. So by skill building, especially in the digital fields, it becomes therapeutic. So it validates capabilities of the survivors, reduce stigma, because in Albania, one of the problems that the torture survivors are facing is the fear of stigmatization. They still do not have right to remuneration actually in the country, and so the stigma remains a problem. By the project, we used to reduce their stigma and foster a renewed sense of identity beyond victimhood, if we can say like that. By linking them to the economic empowerment with emotional recovery, such initiatives restore hope and reinforce that belief that healing is not just possible, but is sustainable, actually. So this is on my experience, or maybe in our Albanian perspective. Actually, this is a new approach toward rehabilitation. Until recently, rehabilitation efforts on our end focused primarily on medical health and psychological support within clinical or even with institutional settings, treating survivors as passive recipients of care. Today, with this new approach, we have evolved into a more inclusive participatory model that centers on survivors and long-term reintegration into the society. Rather than that limiting supports to therapy rooms, we're creating inclusive spaces. So where survivors, our beneficiaries, are co-creators of their healing journey. So I think that this is not only an economic milestone, but is stabilizing force. It offers structures and recognition into the country. So this shifts trust from rehabilitation from a service delivered to survivors into a process shaped with them. Through digital pathways, survivors being among the most vulnerable require continuous support to ensure sustainable progress. This initiative is contemporary, especially in a Western Balkan perspective. It empowers all the torture survivors in the country by introducing the technology, breaking stigma, and enhancing their comfort and self-confidence. These are some of our project milestones in terms of road to the rehabilitation. So as I mentioned before, we used to co-sign a memorandum of understanding with the National Employment Agency as long-term impact for their empowerment and employment. Around 90 individuals have shown reduced and trauma-related symptoms, and I'm very grateful that we're still using the IRCT forums in terms of monitoring their checklist and their progress. As an organization, we use to strengthen the collaboration with 5 companies, agency marketing companies in Albania, to include and support the torture survivors in digital tech industry. As long-term impact, we hope that these companies, they do even their part into inviting them and hiring them. And as one of the main milestones was integrating livelihood support as part of our current therapies as an approach toward the integration and reparation. So when we do our daily work in terms of psychological support, we do even to invite them into the trainings or maybe upcoming trainings or programs, sorry, programs for the livelihood support. During and after the project implementation, we receive by mails on our center with storytelling therapists, etc. We used to receive around 350 new requests in terms of individuals seeking similar empowerment opportunities or participating in our trainings or be part of the organization. I wanna close it with some testimonials. The names, to be sincere, are not real. We do prefer to not share real names in terms of presentation, but I gained some feedbacks after the trainings and after the therapies. So I want to start. Maybe I can leave 10 seconds for everyone to get a look into the testimonials. I think there is no need to read at them or show them. It's some fact, dividing them from the 2 regions that we implemented the project and different group ages.
Perfect,
And,
Kate. Yeah, I think, sorry.
Yeah,
I was still reading them.
No
worries. Continue.
This is the last and I'm done. Actually, some of the lessons learned during the project is that the holistic and individualist care. So one of the core lessons learned is the importance of providing survivor-centered rehabilitation that address not only psychological trauma, but also economic reintegration, social reintegration. So, and I used to learn during the project that survivors must be seen not just as patients, but as rights holders with diverse needs and aspirations in terms of reparation. And livelihood support as a therapeutic tool, integrating it into rehabilitation has proven to be a key driver of long-term recovery. Access to the skills training significantly enhances their self-esteem, reduces anxiety, and restores a sense of purpose, validating the shift from passive care to active empowerment. Trauma-informed and culturally sensitive approaches, programs on our end must be adapted to survivor lived experience, cultural backgrounds, and levels of vulnerability. So an assessment starting from this project will undergo in terms of the survivors to be treated and to be participating on our future programs. So mostly I want to create a safer space and safer environment that fosters trust amongst the survivors and alignment with the global standards for the rehabilitation of torture. That was all. Thank you very much, everyone. And I'm open to questions, maybe Berta.
Thank you, Kay. Thank you so much. Yes, perfect. Excellent presentation. And also interesting to see the comments here. Lisa is making a couple of comments. She was mentioning this, what's the plans for the future from the National Employment Agency in Albania after signing the MOU. So as you can see, I encourage you to also drop your comments in the chat, because I'm realizing we actually have a tight program, because our colleagues from HDO And I think Mary from ACTV Uganda also would like to share their experience. So I'm going to go directly to Anthony from Family Rehabilitation Center, Sri Lanka. And then after Anthony, we can take a couple of questions or comments. And then we go with IMLU and HDO, if you all agree. Otherwise, Anthony, you can go ahead. The floor is yours.
Greetings,
Perfect.
all of you, and it's really interesting to speak to you all this evening. And thank you very much for the leadership of IRCT to bringing all of us together and reflecting in the rehabilitation integration approach, psychosocial level. Thank you very much. It's really interesting this evening. And so let me have a few slides with you and a mixture of experience sharing, the lesson learning, the approach, the methodology we have applied for this approach is where to share with you all for this evening. And
Anthony, I'm wondering if you can share the full screen, because now we can see.
Can you
Yes,
see my
perfect.
screen? Yeah. Okay.
Now it is perfect.
So the project title sounds like the psychosocial well-being for survivor of torture, trauma through economic recovery. Very careful, interesting, bringing some of this interesting words here, survivor of torture and economic recovery. It's very interesting words for us to reflect this evening. The background of our project, if I say, bring it to you very briefly, Sri Lanka had a civil war last 30 years. And this really made some of our civilians to become a trauma and torture victims, really. So where FRC has worked for them, really 111 clients, especially for them, they have rehabilitated psychosocial level and psychological by giving them individual and counselings as well as group counseling, but the psychosocial resilience was built up through the counselings. At that moment, so the FRC and IRCT, the both strategy really intermingled with to apply for this calling really. That's called healing is priority under IRCT strategy 2020-25. It's very interestingly captured with FRC strategy as well. So we applied for a project there, psychosocial well-being for survivors of torture through recovery. And really, why I made purposely the funding there to think, to bring one idea. So when you talk about livelihood intervention, we have to talk about the money, especially the monetary input. So therefore, I have purposely made it there to have thinking comprehensively how this livelihood support us with this 50,000 euro, how it is meaningfully impacted the life of the survivor of trauma, right? So as I mentioned, 111 clients were received counseling support from FRC service provisions in 2019 and 2022. And the client categories are, you can see, the primary torture survivors, secondary torture survivors. So we had really 111 clients on that ratio, and that level, the primary and secondary torture survivors in that level. So the key activities, I would like to talk about the key activities. So first of all, we did a very comprehensive baselines, where the baseline will be helpful to measure the impact, the outcome, and the level of what really changed the people, the livelihood project of IRCT and FRC combination work. So therefore, we take into consideration that we made it very comprehensive baseline, the marketing assessment, networking building, where to bring the social capital for our livelihood project to sustain in the future. Social capital through networking, skill development training program to encourage our survivors to have a human capital, for example, skillful training, skill building. Then business plan training to empower once again with their human capital, and the marketing training where to bring this the social network and the social capital as well as the financial capital. This made BS to have a marketing training and the community-led projects where they practice the skill, the knowledge that they have acquired from this project. Then mentorship, how they can bring the network to go for future levels. So these are the key activities that we have undertaken during the implementations. The baselines, we have underwent a lot of variables were taken into consideration very seriously, but now this vulnerability index was one of the key methods that we have used to understand what is the present, the government have the vulnerability approach. What they talk about their vulnerability. How do they categorize the poor of the poor in Sri Lanka, as well as how do they measure the poverty level of in that level. So we thought vulnerability index approach to the livelihood projects, to where we carefully measure how much one beneficiary is vulnerable to another one. So we have taken into a statistical approach there to meaningfully identify the client, our client, to support them with the monetary input. So the vulnerability index was one of the key approach that our project has used during the baselines to understand. And now you could see in the red line I have marked the family, the government has certified poor by state authority. They have then the more than 2 children and elders populations, and a person with disability, and these are some of the government, the ongoing vulnerability index. So we also mixed with our one. Later you'll see how we have mixed our vulnerability index into this approach. Okay. Yeah. So here comes psychosocial level, resilience level. So we have, can you see how often do you feel hopeful for the future? How often do you wake up with the motivation? How often do you feel self-confidence? Now, these are psychosocial aspects that we checked the baseline level, how much of the resilience that they have, how much of the psychosocial resilience, how much they are weak in psychosocial level to support them. So we have measured the mix with the psychosocial resilience as well as the vulnerability index, where we started our project rationale to carefully understand the need of the clients and to work on this. Very interesting. So in the baseline, we understood, you could see in the red lines I have marked there, 22,000 LKR was the average income of the clients, 98 people who have underwent this baseline. But now see, in the end of the project, we could reach 50,000, 50833. The remarkable achievement within this project input, the livelihood input, has made a short-term impact for the people to reach. So how do we measure that? Then carefully, we can read that say monthly income we have taken into per capita income, district per capita income, and the income gap also we have taken into consideration during the baseline. So we compared with that. Now at present we have a person averagely they have income of 50,000 in their hand as a result of this integrated livelihood approach by IRCT and FRC. That's interesting. One testimony I would like to read it this evening for you all. So one of the female-headed household came to the training. At the end of the training course, when she began to practice a skill into a marketable skill level, she wrote in a book, I am quoting that, I used to buy school bags for my children from shops, but I often found them to be expensive. After attending the bag sewing training conducted by Farsi, I learned how to make quality bags myself. Now I am not only create durable bags for my children, but also feel sense of empowerment, a woman participating in this. This is the one of the testimony really help us to think this outcome of this project in economically level empowerment of the survivors that you have. Now, as the baseline, you could see that we asked them, are you a member of any entrepreneurship training association? You could see 91 people have said no. But in the photograph, your left side, you could see with our banner, project banner, all the ladies, the survivors were a round table, the discussions to having a partnership, how to start the trainings. There are 3 gentlemen who are state authorities people who are really connected to with the community, and now they are at the baseline. We understood there is no training opportunity. Now here comes this project, gives them training opportunity for them to increase the skill that they have. And we have checked whether they have the CBO, community-based organization, for them to socially support their business, though they are increase their skills. But we understood in the baseline on 63, it will be 32. So we could say only yes said 32, so 63 people said no. Then still the project is really meaningful for them to come together, build up a social relationship, to work as a team, So we build the collective leadership so to increase their skills. Now you could see the training photographs through there. I have purposely made some of the baseline data here. Have you received livelihood support last 6 months ago? 80 people said no, 60 people said yes. Still the project is worthwhile for them. So now we given them, now you could see below the left side, lot of available skills. But the skills are home gardening, so very majority of the people, and doing business and preparing food, 5 people. So really we made this with the availability of money and with the skills, with the natural resources, availability of the natural resource. We made 2 interesting community-led livelihood projects. That's called, what you can say, left side, the sewing, leather bag sewing, all the survivors comes together and they collectively make the collective livelihood intervention now. They're collectively coming, building their social capital, as well as the relationship, psychosocial resilience, as well as the peer support. Now they are practicing their marketable skills to improve their economic input for their life. Now the leatherback training is happening. The right side of the photographs, 2 women were sitting in front of the packing for the what is called food process packing machines there. So 2 kind of community-led livelihood interventions were taken place now here with their skills, with the availability of the resources that we have made it here. Have you taken in any vocational training? 70 of survivors said no. This project has given them vocational training, increasing their available skills on leatherback sewing and dry food making. So what this project given them? So we have given them business plan training that you could see the attendance sheet, I have marked it there. And you could see a room with 2 machines and with IRCT visibility and our visibility, FRC visibility. And one of the greatest achievement collectively from the government, we got a free building for our survivors to work with and to lead their business to business. So we could see one of the, this is the government officer, state officer, called economic development officer, is lighting the lamp to start the business building for the survivors. Really this project has made great impact. Bring them their skills and bring them into collective under one business. So physically although there is no building for the survivors to come together to increase their business skills, now they have a building, now they can practice, now they can market their marketable skills through bags, through dry food. This is our sustainable plan now. What this project did during this implementation phase, 60 female were trained on business plan writing. So we have given them business plan writing. And 50 female were trained on marketable training and mentorship. 33 female trained were sewing, leather bags, and food processing. That we have a two community-led business projects. The 60 and 50, they were empowered. And we have built, then we got the state building, then private partnership. Through the mentorship training program, we called all the bankers who are having some business level loans, business level credit for them, where we have connected. So we have 63 female torches were connected, ready with their business plan, connected to the available resources in the network, like bankers and other finance companies, to support them with for their business plan. Ultimately, this project has developed public-private partnership with the state authority, with the private bank, to connect the survivors into their business skills. Eventually, we will have the dream of psychosocial well-being survivor, torture trauma through economic recovery. Thank you very much for the time, for your time to listening to me. Thanks.
Thank you, Anthony. Very interesting. Thank you so much for sharing the vulnerability index, this public-private partnership mentioned now in the sustainability plan. Good. I'm just mindful of time. As I said, we have a packed program. You have to understand that it's 21 IRCT member centers who have been or are currently implementing livelihood projects. So I think they all wanted to speak and say something here. But I'm thinking before we jump into the next presentation from IMLU and HDO, I will leave a couple of minutes to hear reflections, questions, experiences. Anyone else who wants to share experiences? I know, for instance, Tarek from ADMSP, who is with us today here, wanted to share how ADMSP have been implementing a project with a livelihood component. And also Mary from ACTB wanted to maybe share a bit about the VSLA. Sorry, I wasn't seeing your hand up. Hello, Tarek. Go ahead.
Hello all. Thank you for inviting me to this webinar. Actually, I have a question regarding the Nigeria project. My question also stemmed from my experience regarding the project I managed in south of Turkey. Would you be able to fund different beneficiaries project regarding their budget, or you had to fund a fixed amount for all to avoid conflict among the beneficiaries? This question was crucial for us all the time. Regarding my experience, actually, it was for my fortune, I managed a project of interim reparative measure targeted survivor, Syrians one, survivor from detention center and conflict-related sexual violence, and who were able to flee to Turkey. This project funded by Global Survivor Fund and implemented by Association of Detainee and Missing People of Saydnaya Prison. Saydnaya Prison, infamous center for torture for political and opinion Syrians held against the Assad regime. Actually, the project focused on the survivor because the main pillars was survivor-centered approach. So that's why they started the need assessment, participating more than 50 survivors, asking them their needs, and they focused more on psychosocial support and also microfinance project. As you know, as a refugee, you face more than challenge because you lost mostly your asset, the material one and the moral one. I mean here the networking with other people. That was the demand of most of survivors. Most of them, maybe 65%, asked for this both services. So the rehabilitation and the livelihood was selected by survivors themselves. We didn't find or faced any difficulty to integrate both in our project. Moreover, we would be able to get their reflection on the service regarding either the qualitative indicator or quantitative indicator. However, the psychosocial support consider internal referral because ADMSB has a project which called Family Center, which focused on providing psychosocial support for Syrians regarding the warfare and who reside in Gaza and Tab. Also, this project funded by CVT. That all helped me and the team, of course, to offer the service in high level of quality. And moreover, the livelihood made the project integrated. I mean, all what survivors need, we were able to provide them. Of course, we had faced many challenges regarding legal. We had challenges to procure civil document for Syrians because Syrians reside beyond Syria in a refugee or bordered country. Also, sometimes we find difficult to continue with survivor because some survivor ask to call too many because they find peace and tranquil by accompany with the social worker, and that was difficult after concluding the project. However, the end of the project was fantastic because we concluded the project at the same time Syrians get free finally when Assad regime fled country, and now we try to reconduct the project, but in different context. Used to be interim reparative. Now we are going to make sustainable reparative measure. Why? Because now we will come back to our country, to our homeland, and we will be able to support the government to issue the newly law and acts to serve this segment of community. Even though if you need more details, I will be happy to give you any details regarding the project I managed. Thank you.
Thank you, Tarek. I think it's very interesting for us to hear about this initiative, and this was funded. You were saying by Global Fund for Survivors.
Fund, GSF.
Yes. Okay, perfect. So yeah, an example of for us to see that and hear that there's also donors interested in this element.
Yeah.
Yes, thank you so much, Tarek. I'm wondering, Mari
You are welcome.
has the hand up from ACTV Uganda. Go ahead, Mary.
Hello, everyone, and thanks for the panelists for the informative sharings that you've given us. And mine is really to give insights when it comes to our experience into upgrading livelihood in rehabilitation. And my focus really is going to be more with working with the social support groups, more so when it comes to equipping with them with skills in village savings and loans associations. Having at the back of our mind impact of torture on the survivors, which is physical, psychological, the social part of it. We normally consider holistic identification of the beneficiaries. What do we mean with this? We do have we have planned case management meetings where the holistic team comes in to identify the beneficiaries with our focus on limitations. And in this, I mean that we take on people who have been recommended. We know this support will be able to contribute to their healing. And with this, we follow up with the assessment by the social workers. And here we are more interested in identifying the existing skills that survivors are having, their interests in but also their commitment to the given intervention. Then we go on with having courtesy visits to the different stakeholders where the intervention is going to take place. With this, with the social support groups, normally we consider a given geographical area where we know members or beneficiaries will be able to meet, because the intervention takes around 1 year. So we put that into consideration. We normally have memorandum of understandings with the different stakeholders, but also to have these interventions accepted in these areas. We do conduct awareness sessions to be able to sensitize the community about the effects and also ease the integration of these survivors, where you find that some of the common factors of the people in these groups are individuals who are battling self-isolation, the community discrimination. There are those ones, because generally most of the times the social fabric is broken down. Some have broken marriages, some the children are out of school, some are no longer, they fear even to come out in the public. These are some of the cases that we normally take on for these groups. So the awareness creation is key for the communities to appreciate what even it means and to be able to offer support to these members. Normally, we do train them in group dynamics. We train them in coming up with constitutions, the rules to govern their groups. These are times they are registered by the community development offices, and also we train them on VSLA, the Village Savings and Loans Associations, to be able to prepare them, to equip them with the necessary knowledge to run these groups, even when we are not in the area. But we also, after this, the VSLA, after handing over the VSLA kits, we normally do follow-ups, because we've said the intervention takes about 1 year. We normally do routine follow-ups to be able to track the progress, to be able to get where they're having challenges and offer guidance. But it is also important to note that during the course of this intervention, the holistic team normally continues with the follow-ups to ensure that they are given the support they need in the course of the intervention. And also this is accompanied with monitoring and evaluation follow-ups to help us inform where we need to improve. And with this provision of the VSLA kits, we found them very important. Where we've been able to implement them, because they offer safe space for the survivors to offer each other support, peer support, And it gives them a sense of belonging because many of them, because of the isolation, because of the discrimination in the communities, at times they don't interact. But with these groups, the groups offer the survivors a safe space for them to be able to talk about the challenges they are going through. And we've had many of them testify to these groups. They take them as families, for which is the key in helping them to deal with the trauma, the stress, the isolation, the stigma in the community, because the more they interact with these people, the more they come back to be active again in the communities. And also the VSLF groups, they've been key in providing a financial base to the survivors, because at times some of the stigma these individuals face, at times they are labeled as criminals, they are labeled as the criminals, at times terrorists. Others may be those who have survived sexual torture. They find it even hard to be accepted. Even being able to mobilize resources in the communities become hard. But when they when they are put in groups, the mobilization of resources, it's a bit eased, because these groups help them. They provide them with loans and the loans, but also being able to save, which has enabled a number of them to be able to borrow and start up income generating activities. We've seen those ones who have gone into, they've been able to establish food stalls, ice cream. Others have been able to invest in tailoring with the support of these groups. But also we've seen those ones who have been able to, some have been registered as community-based organizations, and they are helping not only the survivors but the entire community. Alongside with these projects.
Mary, I will have to catch you here. I'm just mindful of the time, and that there are still colleagues who want to share their projects. But thank you very much for sharing, especially like this emphasis on how powerful this community engagement or like approach can bring to the impact of the project. Thank you so much, Mary. I'm sorry I have to catch you, but I know the colleagues from IMLU and HDO also wanted to share. I'm not sure who. I think Ruth Kamau is the person who is meant to present for IMLU. Otherwise, Mohammed Ashan, I see you are online here. If you also
Sadakat is here, Mohammed Sadakat is here, Berta.
Perfect. The floor is yours, Mohammed. And we have 8 minutes, if that's okay.
Sure.
Okay.
That's wonderful. Thank you so much, Berta, for giving me the floor. Before delving deep into the achievements the HTU has made, I would very briefly introduce my organization. The HTU is a non-profit humanitarian organization helping survivors of custodial torture for the last 20 years to help them return to the normal life with bios, psychosocial strength, and human dignity. Being part of different prevention organization that is working for the prevention of the torture and human rights protection, HTU has been struggling to ensure that the modern techniques of the investigation are applied in respect of international human rights treaties. We are also honored to be one of the IRCT's family member in Asia, and also enjoy the status of being convener of the IRCT Survivor Advisory Board. There is issue, I guess. Yeah. The livelihood project we have implemented during April 2024 and March 2025. And the target beneficiaries of our project were 120. And the geographical location was Haripur, Mansehra, and Batagram prison. The overall goal of the project was to develop overall well-being of the torture survivors by improving and strengthening their livelihood, assets, skills, and practices. There were 4 objectives to enable torture survivors to develop and improve their technical and vocational skill to generating income and empower employment opportunity for their well-being. To improve their knowledge and confidence by linking them with the market and selling their products. To empower the torture survivors to socially reintegrate, integrate with their families, and contribute into their social and economic needs. To enhance the resilience of torture survivors by establishing support mechanism for training, capacity development, and resource mobilization from other institutions. Major intervention and outputs are the H2 established Beatcraft training centers in 3 prisons of the Khyber Pakhtunkhwa province for the first time in HRC. 120 beneficiaries were selected and provided 3 months Beatcraft training to in making purse, the female purse used most common, necklace, bangles, bracelets, rosary, which are most common among Muslims, and household decoration pieces. We provided them the raw material, the different size and color of the beads. The multiplier factor of this project would be easily gauged from this point that the survivor turned artisans, I'm talking about the 121, further trained fellow inmates at the rate of 1 multiplied 4. That everyone trained person was supposed to train 4 fellow prisoners. And then total was 520, while the indirect beneficiaries of this project are 3,500. We have established display centers in 3 prisons that are fully equipped, promoted their products through different forums, helped them develop their pre and post business plan, and link them with different lending organizations for their for small loans for their post detention startups. Project impacts. If we talk about the project impacts, economic economic empowerment and self-sufficiency, psychological and emotional well-being, social integration and reintegration and community acceptance, legal empowerment and access to justice, reduction in recidivism, relapse into crime. If we talk about the economic empowerment and self-sufficiency of the beneficiaries, the post project assessment shows that 70% of the trained inmates reported increased financial independence after acquiring skills, and their income enhanced from 5,000 to 20,000 per month. 30% of the beneficiaries were able to send financial support to their families, reducing household economic strain and fostering better family relationships. 70% of them developed their own business plans, increasing their potential for post-release entrepreneurship. Psychological and emotional well-being domain brought us a very impressive result that shows that 70%, 75% of the participants reported a significant reduction in stress, anxiety, and depression, which are most common and multiplied because of the incarceration trauma. 70% of the participants showed an increased self-confidence after acquiring marketable skills, and 65% of the trained inmates reported improved sleep and reduced signs of incarceration trauma. If we talk about the social reintegration and community acceptance of the beneficiaries, 50% of the trained inmates reported feeling less isolated and more socially connected with the jail community, while 40% of the beneficiaries who bailed out successfully reintegrated into their community. Reduction in recidivism was very successful. That project played a catalytic role in controlling recidivism. None of the HTO's beneficiaries reported reoffending successfully. Legal empowerment and assessment domain, access to justice domain plotters. 30% of the trained inmates received legal guidance, leading to early resolution of their simple cases. 20% of them use part of their income to hire their legal counsel. If we talk about the integrated model of rehabilitation, we found that segmented approach, only skill development could not bring the desired results of overall well-being of the survivors. So the HTO designed an integrated model of providing medical, psychological, education, formal and non-formal legal assistance, and project certainly brought us the remarkable achievement. Here is the model of the integrated approach we applied. The key lesson of this project of the skill building program in prison have lasting impact. They create self-sufficiency and contribute to rehabilitation and reintegration of the inmates. Beatcraft is a unique form of art therapy. We discovered during the while implementing the project that Beatcraft is the unique form of the art therapy that needs to be further studied and promoted through research. Poverty and mental health both are interconnected and interrelated to each other. There is a need to further understand the importance of poverty on the impact of the poverty on the mental health, criminal tendencies, and torture. Income generation reduces financial tendencies. We found that helping survivors support their families and cover personal expenses within the jail. Economic empowerment, focusing skill development of inmates is a critical as psychological well-being. Skill engagement significantly reduce stress, anxiety, and incarceration trauma. Sustainability requires continued stakeholder collaboration, and market linkages and business planning are crucial, helping inmates transition from training to self-reliance post-release startups. Future direction. We have planned that there should be a diversification in the Beatcraft articles. So we are right now working on that. Start a certificate program. Certificate program help them earn certain remission in their jail sentence. So, if someone has a certificate from the government, she is entitled for the remission. Expand market linkages to further help them sell out their articles. Scale the program up to other jail and diversify skill offering. There need to incorporate certain other trades. Social reintegration of the ex-prison is very much imperative, and we have started the advocacy for legislation in Pakistan. Strengthen legal support mechanism to facilitate fair and timely. Key takeaways. The livelihood development project has changed the life of beneficiaries, providing them economic empowerment and psychosocial well-being with dignity, self-reliance, and hope. By integrating economic empowerment with mental well-being and psychosocial support. Sorry.
So Mohammed, we're now past
Yeah.
time. I'm going to hand over to Batsa so we can
Sure.
we'll share your presentation with everyone. Don't worry.
Yeah,
Oh,
Mohammed.
thank you so much.
Yes. I'm really sorry, but yeah, we have to.
I was left with only one side, I guess.
We will make sure the presentations are all available on Favos. We always
This is the
do.
last slide, I guess. Yeah. You go ahead, please. This was the last slide.
Yes, as we can see. But I mean, unfortunately, we have to really cut it here because because of time. We're already beyond time, 3 minutes. And I apologize because this was my fault, not planning better ahead how many interventions were. And it's good because all of you wanted to share at the end all your experiences. And again, as I said, there has been 21 IRCT member centers who would have wanted to share today here their experiences. What I think we will do is we might need to dedicate, we might want to dedicate another session in fall, because we are currently conducting an external review by Charlotte, who's actually today here with us in the call. She's a consultant who's going to be conducting an external review evaluation on the project, from impact to the effectiveness of the support provided by the IRCT and many more interesting angles. So maybe what we can do is we can dedicate another session in fall to also come back with with this report. But yeah, for now we will have to leave it here. As you can see, you have the poll on your screens with the 3 questions, as always, for you to rate this space. And I want to thank all of the presenters who have prioritized and put some time aside to prepare the presentations today. And obviously to all of you, we've reached at some point 106 participants in the call. And we truly appreciate you prioritizing your time to meet here today with us. I think these spaces are it's becoming clearer and clearer every time, more and more, that these spaces are valuable for the global network and the global movement. So we're happy to continue to see you all. And I don't know, Lisa, if you want to have some.
Thanks, everyone. We'll see you at the next webinar. We're really happy and we look forward to new ideas. That's it. I mean, we'll see you in the next time. Thanks very much, everyone. Fantastic.
Good.
And great inspirations. Lots of learning. We will wrap it up and bring them back to you in many different ways. Thanks.
Bye. Thank you for your comments as well. Taking notes.
Bye-bye.
Bye.
Thank you, Lisa. Thank you, Berta, for giving me the time.
Thank you.
Thank you, everyone.
Bye-bye.
Bye-bye.
Thank you, everyone.
Bye.
Bye.